In a 2020 report, Boji indicated that there were several overdose cases of methamphetamine use during the period of isolation and quarantine. At that time, community transmission had yet to hit the society in Taiwan because of our precautionary measures in response to the COVID-19 pandemic. A year later, incidents of drug smuggling occurred and were found in centralized quarantine centers. In the end of June 2021, COVID-19 infection was discovered in a group of people in 6 major cities. The Center for Disease Control and Prevention called the person suffering both methamphetamine addiction and COVID-19 infection as someone in a special circle of friends. Due to their dual identities of being a drug user who is not heterosexual, epidemiological investigation became more difficult. The so-called invisible transmission chain in the special circle of friends connecting the northern and southern Taiwan was viewed as a struggle for disease control and prevention. This paper aims to share Boji's experience of delivering supportive mental health services to members from the special circle of friends using methamphetamine to facilitate sex during the pandemic. In order not to further stigmatize people participating in this study, this presentation refers Boji's informant as people practicing chemsex, abbreviated as PPCS. Boji explored various mental health conditions amongst PPCS when attempting to alleviate their psychological sufferings associated with the pandemic. The objective of this paper is to explore whether the behaviors among PPCS would have changed during the pandemic. Data collection was largely benefited from participant observation, in-depth interviews, and focus group. Transcripts of interviews and field notes were analyzed for this paper. People who were qualified to be participants of this study had to meet 2 criteria. Firstly, they must be someone who was once supported by Boji in the past. Secondly, they needed to actively communicate with Boji for more than 3 years. Through snowballing, a small number of research participants who actively sought assistance from January to July 2021 and introduced by Boji's existing cases were also recruited. The total number of the research participants recruited to Boji's study between January and July 2021 was 30. Their average age is 34.6 years old. While the oldest is 55 years old, the youngest is 20 years old. Amongst the research participants, more than 60% had stable jobs. 30% worked part-time or had no fixed employer, whose work mainly involved delivery and massage. In terms of education level, about 70% of the respondents completed high or vocational schools. 20% have college certificate and 10% have a master's degree or above. Their average duration for drug use was 6 years, with the longest being 12 years and the shortest being 1 year. 70% of the respondents had experience in injecting drugs, and 20% had stable injection experience. 40% of Bourdieu's informants had participated in or were participating in harm reduction groups. 80% was diagnosed with HIV infection, with an average infection period of 5.8 years. The shortest infection year was 0.6 years. All of them were on highly active antiretroviral therapy. 6 people stopped taking antiviral drugs at the beginning of this study, when supportive care service was also delivered. They started taking their prescription again in June 2021. 60% of the research participants had their first suicide attempt between December 2020 and July 2011. July 2021. The person who had the most number of suicide attempts tried 5 times. The most common methods for their suicide attempt were jumping out of a building and hitting one's head, followed by slitting wrists and charcoal burning. The preceding event within the 6 months before the first suicide attempt were mainly caused by the COVID-19 pandemic, leading to changes in quality of life, learning environment, social life, financial condition, and etc. During the pandemic, 30% of cases experienced pandemic-associated delusion of persecution and surveillance. Only less than 30% of research participants had resorted to community mental health centers, offering supportive resources. Loneliness amongst research participants were reduced through proactive delivery of care services, pre-discussion about possible changes in norms for socializing, and related coping strategies help stress reduction and avoided someone's arising loneliness. The more research participants knew about the social and physical side effects of amphetamine use, the more willing they were to search for support. Evidence shows an increase in death of committing suicide in the United States during the influenza epidemic between 1918 and 1919. Elderly people in Hong Kong were also vulnerable to committing suicide during the 2003 severe acute respiratory syndrome pandemic, which is SARS. So, theoretically speaking, precautionary measures in response to the possible increase of suicide attempts amongst individuals during the COVID-19 pandemic could have been well learned from the past and prepared in advance. However, the shortage of public health or biomedical personnel was adversely affected by the pandemic to cause the further uneven distribution of medical capacity in different regions. The systems for care delivery and support were hence negatively impacted. As most of the PPCS was diagnosed with HIV infection, they were enrolled in HIV case management programs for comprehensive and holistic support. However, the amount of service, regardless of its quality, delivered to PPCS had dropped significantly during the pandemic. While public health and biomedical workforce were occupied by disease control and prevention, as well as saving lives. Anything not related to curtailing the COVID-19 pandemic was suspended. For people struggling with mental health issues or suicide attempts, resorting to support or assistance from others may not be viable. While some could have no idea about how to navigate the healthcare system or community mental health centers, others would not like people other than themselves to know their personal conditions, which were highly socially stigmatized. There were also cases not comfortable with having people around them at all. Personnel or matures who could be less affected by the pandemic could possibly support people whose roles are similar to gatekeepers in preventing someone's suicide attempts from becoming a reason. Through stable, proactive care and companionship facilitated by digital communication software for more supportive conversations, people with suicide attempts may feel supported and accompanied in an effective manner. Encouraging clients to actively seek help or find support through various platforms such as using Canva can help people to reduce anxiety. Those who had suicide thoughts and attempts in the past are more likely to trust and persuaded by health or social support providers to accept mental health services. Fortunate enough, the commander and the deputy lead of the medical response team at the Center for Pandemic Control and Prevention in Taiwan have long-term experience for AIDS control and prevention through destigmatization. So they have been very aware that the transmission of any infectious disease may cause panic and discrimination against victims. They are also sensitive to the fact that any attempt for witch hunt during the pandemic is not going to be helpful for people's life, public health, society, and etc. These show that the Center for the Pandemic Control and Prevention in Taiwan was very determined to fight against stigma and spoiled identity as a label that the public like to draw on to attach to the affected individuals, particularly social minorities. This era is unprecedented. The global coronavirus pandemic has caused both social and physical suffering to many people, exacerbated mental health issues and individual suicide attempts. The impact of the pandemic on one's mental health will last longer and has yet to reach its peak in the post-COVID-19 pandemic. Measures to prevent individuals from suffering compromised mental health needs to be deployed and intervene in advance to reduce the occurrence of regrettable events that have been happening every day now. Thank you for your attention. On behalf of Borje, I look forward to hearing from you.